Our COVID case rates are falling rapidly, and I do see hope that this epidemic is fading, but it's still extremely important that those who are not vaccinated yet get vaccinated now to keep it that way. Here are the numbers. Cases in Philadelphia for the past week, May 2nd and May 8th, the data in which the samples collected, we averaged 241 cases per day so far. Expect more. And of those people tested, 3.2% tested positive. Both of those numbers are much lower than the previous week, April 25th to May 1st, where we averaged 404 cases per day and 5.1% of people tested positive. That's what's happening in Philadelphia, but elsewhere, we're seeing cases that are continuing to fall very quickly around the region and around the nation as a whole, and in fact, in almost every state in the country. Now, back here in Philadelphia, we did identify 4 new deaths from the coronavirus infection since yesterday, bringing us to a total of 3,533 since the beginning of the pandemic. We had 60 deaths the week of April 11th. That number appears to be dropping. It dropped to 45 the week of April 18th and 38 the week of April 25th. We hope it'll continue to drop from here. I'll give you an update on where we are with vaccination. As of yesterday evening, we had given vaccines to 811,000 people for their first dose and 579,000 people that are fully vaccinated. Now, among the people who are the residents of Philadelphia, according to data from the CDC, 39% of people over the age of 18 are now fully vaccinated. Now, we estimate that it's about 49% who have had 1 or more doses. According to CDC data, 61% of people over the age of 65 are fully vaccinated. We estimate it's about 71% now have 1 or more doses. Now, as far as what we are continuing to deliver, our weekly vaccinations that were being administered across all providers has been falling with the decreasing demand. We have plenty of availability, but it's still large. For the week of April 24th, there were 89,000 doses administered across all providers across the entire city. The week ending May 2nd, there were 65,000 doses administered. And last week, there were 64,000 that we know of already, more coming in. So we expect to be a little bit higher than we were before. So those are still large numbers. And the availability of vaccination continues to increase. We're now at 286 sites across the city that are enrolled in receiving vaccine. That's 4 more than where we were last week. Talk a little bit about our 2 federally supported sites. At the convention center, we're now giving second dose Pfizer vaccine. And the number of people going through there is high to match the number of people who came in getting their first doses 3 weeks ago. It's about 4,000 people per day. Now, I expect that number to decrease pretty quickly in the coming days to match the decrease that we saw about 3 weeks ago. And with more staff availability with those lower numbers, we will add availability of the Johnson & Johnson vaccine at that site starting May 11th, continuing through May 25th. We'll also be taking new people coming in for their first doses, so that people still have the opportunity to go to the convention center, and we'll figure out how to get them their second doses subsequently. Now at Esperanza, we are also doing our second dose Pfizer vaccine, and we'll continue to take, people for their first doses. For those people who get their first doses at Esperanza, they'll get their second doses at various neighborhood clinics that are available across the city. The Esperanza site will finish on May 25th. Now, the city-run neighborhood vaccination clinics are continuing about 1 or 2 per day in different areas of the city. The number of people coming to them has been dropping with decreased demand. And all these sites are now taking walk-ins. Now, I should say that we are starting now to celebrate what we're calling Teen Week. That's a focus specifically to get teens between the ages of 16 and 18-year-old vaccinated. So we're adding teen-friendly things like DJs and drum lines and bands, and even Gritty to our clinics. So these activities have been designed by teen vaccine ambassadors, who are teens who are already vaccinated and are now helping to spread the word. So just to mention 4 days of events, on this Friday, we'll be at the EOM Athletic Center in South Philly. We're going to be partnering that with the Flyers and with Gritty. And on Saturday, May 15th, we'll be at the Deliverance Evangelistic Church, the Black Doctors COVID Consortium for Senior Day. And then on Tuesday, May 18th, we're going to be at the University of Sciences. And Thursday, May 20th, we'll be at Simon Gratz High School with some teen-friendly activities. Now, speaking of teens, let me talk about the 12 to 15-year-olds. As you probably know, the FDA has approved the use of Pfizer vaccine for teens in that age group. The CDC Advisory Committee is meeting today, and we expect that they'll be approving that vaccine as well, which means that we can start vaccinating tomorrow for these teens at most of the same vaccination sites where adults are getting the vaccine now, wherever they're using Pfizer vaccine. So if you're a parent or guardian and you want to have your child between the ages of 12 and 15 vaccinated, come to the clinic with the child and just bring some document that's showing the child's birth date. Now that includes a convention center or Esperanza. These are sites that can handle large volumes. So if we have a rush right when this authorization starts, the people can go there and get vaccinated. Now, how do people get vaccinated? Just remind people that there are two websites that provide all the different information you want. www.phila.gov/COVID. You click on Get an Appointment on the red banner. That will list all the sites that the city government is involved in, or www.vaccines.gov. Will give you the search for all the commercial sites, such as pharmacies and clinics. Now, most of those sites are now accepting walk-ins. Including in that is Rite Aid. Now, Rite Aid has 77 stores in Philadelphia. It's the retail chain that has the largest footprint in the city. And included in that are the low vaccinated neighborhoods. All those stores now are accepting walk-ins for anyone over the age of 18. The reason it's 18 is because they use Moderna vaccine, not the Pfizer vaccine. Rite Aid still suggests that people, if they can, go to riteaid.com/COVID-19, set up an appointment to reduce the wait time. But people can still walk in. So it's a good opportunity for people who are too busy to travel and unable to schedule online to get vaccinated. And this kind of regular, ongoing neighborhood walk-in site, I think, is the future for COVID vaccinations. So I want to thank Rite Aid for making all those sites available for walk-ins. Now let me talk about the social distancing restrictions. As the mayor said, in view of the rapidly falling case counts, even in areas of the United States with very few social distancing restrictions right now and rising vaccinations, we feel comfortable further dropping restrictions. So effective this Friday, May 21st, most of the settings in the city will be allowed to increase to up to 50% capacity, with a minimum distance between people of 3 feet instead of 6 feet in this fixed seating settings. But masks will still be required indoors. Now, let me give you a few key changes in some specific settings. In offices, there'll be no density limits. So if employers want, starting May 21st, people can start coming back to the office to work. And masks will be required unless people are in a room on their own. Retail stores, museums, and libraries will have no density limits. Theaters and other gatherings with fixed seating, indoors and outdoors, can go up to 50% occupancy with a minimum of 3 feet between people in different groups. Restaurants indoors will still be at 50% capacity or 75% capacity if they meet our enhanced ventilation standards. But now there'll be a minimum of 3 feet, chair back to chair back, instead of 6 feet, which will allow those restaurants to have more customers. Before, many restaurants couldn't even meet the 50 or 75% capacity because of the 6-foot rule. And in restaurants, we'll be ending the requirement that food has to be served with alcohol. Catered events outdoors will be 50% capacity with no maximum number of persons. Now, catered social events indoors, this is what we consider to be the riskiest activity, but still would be a maximum of 25% occupancy and a cap of 150 persons. Now, detailed guidance on all these settings will be posted on our website by the end of the week. Then, as the mayor said, on June 11th, we will drop all required limits on the number of people or activities in any setting. But everyone will still have to be wearing masks unless they're eating or drinking. And we'll still have guidance. Those are recommendations, not requirements, to help people voluntarily stay safe. Most important recommendations are these. First, keep wearing a mask indoors. And second, now and in the future, do not attend crowded indoor settings unless you're vaccinated. So if you want to go to a theater or an indoor restaurant or a stadium or a party or a wedding, get vaccinated first. Let's talk a little bit about the future. I sincerely hope this represents the gradual end of the pandemic, but it is possible that we'll see another wave in the fall or even in the summer. And when assessing future epidemic waves, we'll follow our indicators a little bit differently. We'll still track case counts, but more important, we'll track the number of people who are getting seriously ill from infection. We'll do that by paying attention to the number of hospital admissions for COVID each week. To give you a sense of the range there, on April 18th, we had 215 hospital admissions, people brought into hospital for COVID. With declining case counts, that number should drop from 215 to fewer than 100, as it did last summer. If it does drop to fewer than 100 and then increases again to more than 100, that's when we'll be concerned that this is a new wave. We'll consider taking additional steps to slow the virus. Finally, let me say this. Since we're approaching the end of legal restrictions, I want to comment on the past 15 months. I know the shutdown has been extremely difficult for everyone. People have lost their jobs, people have lost their businesses, our children have lost out on their education. Everyone has suffered from being separated from others. You know, we humans are social animals. We're not designed to be kept away from other people. And that suffering has tested the mental health of many of us. Some people will question whether it's worth it. But I can say this, although we've lost more than 3,000 lives in Philadelphia, I believe we have also saved thousands of lives. And we prevented the crisis in hospitals that is now taking place in India. So although we paid a price with restrictions, I believe it was worth it. And while we had legal restrictions, we couldn't have done it without the voluntary cooperation of more than 1 million Philadelphia residents. You know, we all know some people who didn't listen to safety advice, but most people, most of the time, did the responsible thing. So to every Philadelphia resident who has suffered from the shutdown, I just want to say, I'm sorry we all had to go through this. But from the bottom of my heart, thank you for doing your part to save the lives of others. And I also have to ask, if you want to maintain those gains, get vaccinated now. Thanks.
Thank you, Dr. Farley. Now we'll have Armando deliver a summary of these remarks in Spanish. Thank you, Armando. We will now move to Q&A for members of the press. In addition to Mayor Kenny and Dr. Farley, we're joined by Managing Director Tumar Alexander, David Wilson, Deputy Managing Director for General Services, Arts and Events, and Kathleen Titus, Consultant for the Philadelphia Marathon Weekend. Because of limited time, only one representative from each media outlet is permitted to ask questions. Reporters are asked to limit their questions to 3 or fewer. We will limit the first round of questions to the topic of COVID-19. If you have questions regarding other topics, please hold them for the second round. If your hand is raised and your question is not about COVID, please lower it now and we'll let you know when we open it up to broader topics. First up, we will go to Laura McChrystal with the Inquirer.
Hi, my first question is for Dr. Farley. Why did you choose the date of June 11th for the reopening rather than going with Governor Wolf's choice of Memorial Day?
It just gives us more time for the case rates to fall and for vaccination rates to rise. So just a little extra margin of safety.
Okay, and after June 11th, with everything lifted but the mask mandate still in place, would you plan for any kind of enforcement of making sure that, businesses are having people wear masks, or, people at events or sports games? How would there be enforcement at that point?
We will enforce where we can and how we can. So we already inspect restaurants, and so we'll be enforcing rules at restaurants. We will be, although at restaurants when people are eating, they're not wearing a mask. They are maybe wearing a mask when they're not eating. And we enforce on complaint. So if we get complaints that people are in indoor settings without wearing masks, we can send inspectors for that. We're also in communication with the sports teams. And if we get complaints from the stadiums that fans are not wearing masks, we will communicate with them.
Okay. And my third question is probably more for the mayor or Tumar. With less than half of the fire department vaccinated and the police department not tracking, they say how many officers are vaccinated. How is the administration encouraging vaccination among public safety workers? And is there a safety issue in the future with not knowing which of them are vaccinated?
We encourage people every day, whether they're our employees or everyday citizens. We can't force people to accept the vaccine. We're hoping that as many people in the public get vaccinated, so the issue will become moot at some point in time. But Tumar, if you have anything else to add, please.
Nothing much other than what you said, Mayor, other than the fact that we are still working with those department heads and union leaders and folks internal to those departments to continue to encourage employees to get vaccinated.
Thank you.
Thank you, Laura. We will now go with Martin Pratt with Philly YBN.
This question is for Dr. Farley. Dr. Farley, I heard you mention what the department is doing to attract teams. I'm curious to know what, if any, TikTok or Snapchat that you're doing outreach on.
You know, when you're talking TikTok and Snapchat, that's a little younger than my my cohort. I can say we have social media staff that are doing that are young and know more about all the different social media channels, and we're doing a lot of social media messaging, but I can't tell you exactly which channels.
Okay, we'll be watching for that. The second question is a more serious question. Based on the stats and numbers you talked about as far as our loss as a city, when you look at Philadelphia compared to other cities, would you rate us in the top 10 cities that was successful in navigating this pandemic?
You know, I don't know exactly what scale to look that on. I have not looked at mortality rates from COVID and across different cities. Some of the things are hard to compare. Depends how well that people are doing surveillance. You know, I can say we've done the best we can to navigate this very, very difficult situation. And there's no perfect way to do this. And the health department has worked really, really hard, and I'm terribly proud of my staff and everything that they've done. And I do believe that we've saved thousands of lives.
Well, I also want to add that at no time were our hospitals overwhelmed or overrun. We set up a field hospital at the Lea Core Center, and I don't think that was even used. It may have been used by a couple of patients, but we had no real need for that either. So we were prepared. But you know, if you look at countries and states where the hospitals were just overwhelmed, we never had that situation here.
Right. Last question. Based on being able to, we see the drop off and people getting the vaccine. Do you think, Dr. Farley, that I actually was offered, when I went to CVS, I was offered the Johnson & Johnson vaccine as just walking up and say, hey, do you want Johnson & Johnson vaccine? Do you think that's possible that folks are not taking the vaccine because of the fact that what's being offered for free and readily, not say for free, but I mean, offered a lot is Johnson & Johnson versus I've never been offered the Moderna or the Pfizer.
Yeah, I'm glad that you were offered the Johnson & Johnson vaccine, that they prompted you on that. But actually, most of the vaccinating we're doing is with the Pfizer and the Moderna vaccine. So there may be some hesitancy around Johnson & Johnson. For those who are hesitant, there's plenty of other opportunities. You know, of our 280 some odd sites, if not all of them, almost all of them are offering those other vaccines.
Thank you.
Thank you, Martin. Now we will go with Lauren Meek from NBC 10.
Hi, good afternoon. Dr. Farley, I first wanted to just clarify something to make sure that we fully understand. So after June 11th, what restrictions will still be in place? The mask mandate, and then there is a capacity with mask the catering?
No limits on density or activities anywhere. Only the mask mandate after June 11th.
So those catering ones go away as well?
Correct.
Okay. So regarding the mask mandate, that is the thing that you are keeping in place. What are your expectations for when that mask mandate can be lifted?
I don't want to put a date on it. I would say that I want to watch what's happening to the epidemic here around the country, what's happening to our vaccination rates. You know, right now, the rates are falling quickly. I'm hopeful that the vaccine is the reason for that, but I can't be sure. I think if we have more evidence that the vaccine is the reason for that, then we can feel comfortable we don't need masks. But if I think this is just sort of the seasonal behavior of the virus, then I want people to keep their masks on.
Do you think there's a possibility where you're going to tell people to keep wearing masks indefinitely?
Well, let me just jump in. I mean, the flu cases last flu season were basically non-existent because people wore masks and kept from getting the flu. So someone who gets the flu, who gets bronchitis twice a year or used to, I intend wearing my mask through the winter.
Just this year or continuing forever?
Whenever, I mean, I think that flu season, again, the flu's dangerous too, but if it keeps you from getting the flu, even if you are vaccinated from COVID, it's not a big deal. It's a very late thing. We're not asking people to carry a piano down the street. So I don't ever understood frankly, the whole, the whole culture war on masks, but, keeps you safe, keeps you healthy, and keeps you from being sick.
Dr. Farley, did you have something else on that? I mean, but the question for you was, do you foresee a possibility of asking people to wear masks indefinitely?
I don't know about indefinitely. I can certainly say possibly through the fall. We know that this virus last year was at its worst in the middle of winter. And so if it's going to come back, it may start to come back in the fall and the winter. And so we may be wearing masks in that season.
Thank you.
Thank you, Lauren. We will now go with David Melandra with Philly Sports Network.
My question is for Dr. Farley. I just want to get your reaction to Pennsylvania Governor Tom Wolf just came out. He's increasing the capacity limits from 50% to 75% for outdoors and 50% for indoors. I want to get your reaction to that.
That is very similar to what we're doing here. We're allowing 50% indoors. Outdoors, it's a little bit higher, but it's for a very short period of time. So we are not exactly in alignment with the state, but very, very closely aligned.
And on June 11th, when everything else gets lifted, will tailgating be permitted back?
Yeah, I mean, I don't know whether tailgating is restricted by others, but it won't be restricted by the health department.
Okay, and final one for me is, what made you came with the decision for June 11th to have everything lifted, and especially, are there any other concerns you have, like say when the stadiums are back at 100% capacity?
The public mood for restrictions is getting lower and lower. The case rates are getting lower and vaccination rates are getting higher. So at some point, it makes sense for us to stop the requirements while still having recommendations. As far as your second question, I am concerned in any indoor crowded setting of risk, which is why I really made the point that you need to continue to wear masks and get vaccinated. For people going to the stadium where there's tens of thousands of people, they should get vaccinated first. They should also wear a mask. If people do that, then they can really enjoy the ball game safely.
And last one for Mayor Kenny. A couple months ago, it was talked about saying Philadelphia's one big event we host every year is the Philadelphia Auto Show. Are there any talks about having that this year?
I'm not sure. What was that? I'm not sure. After that last year with everything being canceled, I forget the date. What was the normal date for it?
It would have been first week in June.
I don't see any reason why they couldn't, but I don't know whether there's enough time for them to organize it. You'd have to really ask the dealers.
Thank you, David. We'll now move to Johan Calhoun from Chalkbeat.
Thank you. These questions are for either Dr. Farley or the mayor. I noticed your restriction list. You have restaurants, offices, retail spaces, casinos, and whatnot. I'm curious, why did you decide to leave off schools on the list, especially as we head into graduation season?
So, schools follow the same. We're basically following the CDC guidance, and so they're following a 3-foot rule now, which is consistent with what we have here. So I don't know that there's any difference there. And then, as effective June 11th, there's no restrictions.
And we've been saying all along we want schools open fully in the fall, and working towards that.
Okay, I'm glad that you mentioned that, Mayor. So with June 11th and with all students returning this summer and indefinitely for the fall, will face masks be made mandatory?
Doc?
The masks will be mandatory on June 11th, as they are now. And we'll see over time how long that'll be necessary. I can't say whether it'll be needed in the fall.
Okay, so when the students go back for the summer, after June 11th, it's up in the air?
After June 11th, they should assume they're going to be wearing masks.
Okay, and let me know if I'm correct with this, but you're not making it mandatory, but you're urging that students get the Pfizer vaccine. But what kind of outreach are you providing and making them aware of this?
Well, starting with this, the publicity that all the press is going to do, that this is now available down at age 12, and making it available at any site where they have Pfizer vaccine, which is a good percentage of the vaccine sites in the city. And we're doing general promotion of vaccination. It'll be included in that.
So any kid from pre-K to 12th grade can sign up for the vaccine right now?
No. If the advisory committee tomorrow allows Pfizer vaccine to be used down age 12, then any child over the age of 12 can get Pfizer vaccine, including 12 to 15 Pfizer vaccine, 16 to 18 Pfizer, 18 and up, they could get any vaccine. No child is going to be eligible to get vaccine up to the age of 12 until additional authorizations are made. And that'll be the fall or the winter.
Okay, and this is going to be finalized tomorrow?
Probably for the 12 to 15-year-olds.
Okay, thank you.
Okay, thank you, Johan. We'll now go to Jack Tomsick with Metro, and then we're going to open up the floor for a second round of questions.
Thank you. Question for Dr. Farley. Is there a way for parents to know what sites are offering Pfizer versus Moderna versus Johnson & Johnson?
I'm fairly certain if you go to our website and you www.covid, schedule make an appointment, you look at that list there, that'll show you which vaccines are available. And I believe you can even search by the specific vaccine type.
Okay. And just a clarification here, at the convention center, people going in for a walk-in appointment can get a Pfizer or Johnson & Johnson shot.
Effective the 11th, I guess that's today, yes, they can get Johnson & Johnson or the Pfizer. And so although that site was scheduled to complete its regular activities on May 25th, we're going to continue to take people for their first dose of Pfizer, and we'll make arrangements for them to be able to get their second dose.
Okay, thank you.
Thank you, Jack. I don't see more hands raised, so thank you. And thanks to all participants. That concludes our weekly. Oh, I see one more. George Solis. I don't see the outlet, but I'm going to ask you to unmute.
George Solis from Channel 6. This question could be both for Dr. Farley and Mayor Kenny. You mentioned learning from the COVID-19 virus and its behavior as it relates to masking. What would you say for the people that have just been hearing about this for the last 12 to 15 months, all the misinformation and information in general, the most important thing that we've learned about this virus, and as we turn the corner here to lift these restrictions, that people just, the one thing that you would say is the most important thing we've learned about this virus as we move forward?
I would say there's two things important, that a simple mask can make a huge difference in protecting everyone, and it's not hard to do. And then the other thing is that these vaccines are excellent vaccines. And so if you want to be really safe, get your vaccination.
Mayor Kenny, anything you'd like to add as far as the structure and just how we implemented everything? And, you know, again, here we are turning the corner, it sounds like.
You know, I am always been hesitant to predict the future. I can't guarantee that this is the end of the epidemic. It may come back in the fall, it may come back in the summer, it may come back in the winter. I do think we've made enormous progress. I'm really optimistic about where we're headed from here. And if people just do a few simple steps from here, that'll help us get across the finish line.
All my questions, thank you.
Thank you, George. Okay, I see more hands now, so we'll go with Rosemary Connors with NBC 10.
Thanks for that. Let's see. Dr. Farley, I guess my question is to you, and you sort of touched on it with the last question, but you know, given what's going on in India, do you have concerns that there could be more variants out there that we don't know about that could impact the efficacy of the vaccines? Does that change in any way your outlook as we move forward?
There are, the virus that's circulating in Philadelphia right now is different from the virus that was circulating a year ago. So it constantly produces new variants. So far, all those variants appear to be still prevented by the vaccine. And so I feel good about that. I cannot guarantee that this may mutate in a different way. In the future, we'll need a different vaccine. I think we're better prepared now than we were in the past for that. And so I'm still overall optimistic. But what's happening in India is a cautionary tale. The fact that case rates are rising doesn't mean that we can just drop all restrictions and think we're done. They did not vaccinate enough people in India. They opened up and the hospitals became overrun. So we went through some tough times here, but the hospitals were always available for people who got sick.
Thank you.
Thank you, Rosemary. We'll now go with Dan Stamp with NBC 10.
Well, we're on the NBC 10 roll. This is a question probably for either Mayor Kenny or Dr. Farley. The Phillies play the Yankees June 12th. Will there be 45,000 people in the stands if they buy the tickets?
You know, the Phillies will be allowed to sell as many tickets as they want. I don't know whether that many people will come to the stands.
Thank you.
All right, thank you. See one more question from Laura McChrystal.
Hi, just one more from me. Dr. Farley, the current 11 p.m. curfew on dining, when will that be lifted? Will it be June 11th or earlier?
June 11th.
Okay, thank you.
Thank you, Laura. Last call for questions. All right, seeing no more hands. Thank you, and thanks to all participants. That concludes our weekly briefing on COVID-19. Dr. Farley will hold a press conference with Mayor next Tuesday. Thank you very much.